11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak in the nation. In just a few moments, we're going to cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. We're going to go now into the briefing room where Kim Gang-nip, overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be sharing with us the latest figures and updates on the COVID-19 situation in the country. So he will be sharing the latest number of infection cases as well as updating us on the death toll. It looks like he's taken to the podium now and will begin the briefing very shortly.
And we also have Mr. Park Jong-hyun with us today for the briefing. And we have sign language translation available. First of all, here is Mr. Kim Gang-nip with the briefing on the COVID-19 response here in South Korea. Let us now begin our regular briefing for May 13th, Wednesday. As of today midnight, we have 26 new confirmed cases. And of them related to Itaewon, there are 21 cases. And aside from them, we have 1 community transmission and 4 imported cases from overseas. And a total of 15,000 cases of diagnostic testings have been tested yesterday. And we have a total confirmed cases standing at 10,962. And of them, 9,695 have been discharged following full recovery. The death toll stands at 259. And unfortunately, we had one more fatality as of yesterday. I extend my deepest condolences to the deceased. KCDC held a meeting today presided over by Prime Minister Chung Se-kyun. We talked upon the issues of the municipalities in relation to the Itaewon Club infection, and we also discussed the support measures to support these municipalities in responding to the club infections. And Prime Minister Chung Se-kyun stressed that the identities of the testers will not be revealed, and they will not be asked of anything else. And he also once again urged that everyone who have visited the Itaewon area needs to get screening testings. And the KCDC also discussed the municipalities' responses cases in relation to the Itaewon case. And thanks to the voluntary participation by the public and the quarantine measures authorities, we have had about 20,000 cases of diagnosing testings so far. And in order to curb the secondary and tertiary infections through the Itaewon Club case, we believe that identification of the patients at an early stage is essential. We are utilizing data including the mobile traffic areas, traffic, as well as the credit card record usage and the surveillance camera footages to find and track down the visitors. And we have also expanded those who are subject to the screening testings, and we also have included all of them who have been in the area to get tested. And in relation to this, even when they are confirmed positive, we will have the private information deleted, and their movements will be revealed only to limited scope. And we will have new guidelines to reveal the information of their movements. And likewise, the quarantine authorities are currently exerting its utmost efforts to protect the private information of these people. So we once again urge every one of them who have been visiting the area to get screened testings as soon as possible. We believe this is a matter of time. And as people become complacent and hesitant, we believe that this could lead to greater challenges on the society as a whole. And as we have increase in the demand of testings in the area, we will have more screening centers dispatched at the Yongsan-gu district, and we will have more people to get the screening testings possible. And we also have put in place executive orders for these nightlife venues, and we will continue to crack down on these nightlife venues that are open late at night. And we will prevent the further spread of the case to have to move into a community transaction. And in Incheon City, we have one reported case, and we have found that in the epidemiological investigations, the truth was not revealed, and we also identified that this person was working at a lecture as at the private academy. Therefore, we have confirmed that these confirmed cases have also went to church services during the weekend, and we are also expanding our epidemiological investigations. Due to false testimonies, we have found that this case has hindered our quarantine guidelines and quarantine efforts, and this will help us to hinder our efforts to deal with the secondary and tertiary infections, and it could lead to another similar case like the Sincheonji case that we have witnessed so far. So we ask all of the members of the public to cooperate in our measures, and also you need to have responsibility as a member of the society, and remember at all times that this could be a threat to yourself, your family members, and the community as a whole. So we also ask the public to have to refrain from discriminating and condemning the confirmed cases. And such an act could lead to more people from concealing and from hiding, and as a result, they could hinder and threaten our society as a whole. And this could also affect our sense of solidarity and unity of the community, and we shall always remember that we are a community, and thus we need to cooperate in joint efforts. Next, we have designated the infectious disease hospitals and in the local areas, and the following updates are as follows. We have designated hospitals, and we have also designated public safe hospitals as well as infectious disease hospitals. And as for the other hospitals, they have witnessed financial difficulties after the outbreak of the COVID-19, and especially for the local clinics that have a higher rate of the hospital beds dedicated to treating COVID-19 patients, they are going through much bigger difficulties. And the governments of the local municipalities, we have currently supporting them with the compensations in terms of financially, and also we have providing them increased loans so that we could ease their financial burdens. First and foremost, all of these losses incurred due to the treatment of the COVID-19 patients will be given at an earlier pace so that we can help alleviate the difficulties inflicted by these outbreak. And as for the decrease of the life treatment centers, we would also like to compensate the losses that have occurred at these clinics, and we also have agreed by May, late May, we would give the compensation, which amounts to about 120 billion Korean won to these local clinic hospitals. And as for these losses, they also include those that have occurred due to the loss and due to the decrease of the hospital beds at these clinics. And as for the compensation that needs to be treated for the loss of the empty hospital beds, we would also provide increased compensation for this as well. And considering that this needs certain time for the payout to be executed, these payments will be given out on a regular basis so that we can regularly ease the financial difficulties of these hospitals. And we will also expand the loans for these medical facilities. And the government has also designated a sufficient amount of budget. And we also have, during the past months, we have also secured an additional amount of loans amounting to over 170 billion Korean won to some 6,000 local clinics and hospitals. And this will help the hospitals and local medical clinics to increase their cash liquidity. The government also will help the pharmaceuticals and pharmacies, as well as other hospitals that are also subject to the national health insurance. And so far, we have supported them with over 1 trillion Korean won, and these were payout to the 5,000 local pharmacies as well as hospitals nationwide. And they also included the life treatment centers as well as the designated hospitals for respiratory symptoms. And we will increase our budgets for the support, and they will be upgraded to about 200 billion Korean won. And these will help to deal with the financial difficulties that they are going through. And we will make sure that no one is left behind in terms of getting the wages so far. And also, on top of this, we have provided great support for the medical staff members who are working on the front lines. And also, starting from March 24th, as for the negative pressure hospitals, we have increased the incentives for these places. And as for the mental hospitals and the other life treatment centers, we have increased the incentives for these hospitals. And as for the mobilizing of the new of more medical practitioners, we have made sure that they have no medical vacuum in other facilities, and we are also closely linking and monitoring the trends as well. And in this sense, we want to alleviate any of the financial burdens that these hospitals are going through as they treat COVID-19 patients. And the treating and of the COVID-19 patients are possible because of the dedication put forth by the medical staff members. And in order to pay tribute to them, we have launched the Thanks to You campaign, and over 16,000 people nationwide have participated in such campaign. And many people in the political arena, and also many other, including famous sports players, have also participated in such message. And with the launch of our baseball and football leagues, we also have many football and baseball players participating in this campaign. And we also have our SNS account for the Thanks to You campaign. And we also are trying to give out 1,000 badges to the public up until May 31st. And we believe that this challenge could be of great help for the medical practitioners who are fighting on the front lines. And we will alleviate any of the financial burdens that they are going through. Next is relation to the blood supply of the country. And during the past week, we saw a decrease in the donation of blood supplies. And this was due to the decrease of the blood donations, as we have seen a delay in the school openings, which accounted for about 30% of the students donating the blood. And we also have seen an outbreak of the Itaewon case, and also this was because we have an increased number of surgeries that are being carried out that have been delayed, especially due to the COVID-19 outbreak. And thank you so much for the donations. And also we ask the public to continue to participate in blood donation, which can be essential in saving the lives of many patients nationwide. And we will make sure that to make and guarantee a safe environment of blood donation. And as for the occupations and the personal information of the visitors to the club are being revealed online. And many of the foreign press are also praising the Korean quarantine measures. However, they say that these measures have been put into test due to the discrimination and hatred towards a specific group. And we need to remember that these hatred and discrimination could lead to avoiding avoidance of the testings by these people. So we ask the public to refrain from doing so. The public, as they did so far, we believe that we need to once again remember the sense of solidarity and cooperation, and we need to make sure that our efforts are not in vain, and please show high level of civic awareness. Thank you very much.
That was a live briefing from the South Korean health authorities updating us on the COVID-19 situation in the nation. We just heard that there were 26 additional cases of COVID-19 in the country, bringing the total to 10,962. The total death toll with the unfortunate additional deaths now stands at 259. Well, that wraps up our coverage of this morning's briefing. Thank you for staying with us. We'll be back shortly with our regularly scheduled newscast at 12 p.m. Korea time. Goodbye.